I appreciate you taking 5 with me this Thursday evening, especially if you are sitting in traffic on the west side, because guess what? Next week is fall break for public schools. So it should be a little easier to cruise on through. So I am looking forward to that. And while you're cruising, if you see a really nice wrapped vehicle, it's probably because of 808 wraps. So if you're in need of branding for your business and want to increase revenue by $1 million in 5 years, that's all it's going to take. 5 years. Have some patience, business owner. It's $1 million. Call them 808-999-7277 or visit 808wraps.com to get a quote today. Now, Bianca, I have the perfect wrap for your car.
Uh-oh. Here we go.
It's electric.
Oh my God.
And then you can trail off with the boogie woogie. No? Okay.
No boogie woogie here.
No boogie woogie. It would be perfect. But we're talking about the Electro Equiscope.
Yes.
And electric treatment. And the fact that electricity or RF frequency can actually heal and make you feel better. So we talked about our furry friend Peso in the beginning of our segment, but I want to transition over into how this helps people who are ailing with things. So I'm guessing the Electro Equiscope works for both types of populations.
Yeah, it can tell the difference between an animal tissue and a human tissue. Again, we're talking about technology here that is communicating at such a high rate that you can't even fathom that it's actually, you can tell the difference between if I'm touching a human being or an animal. That's crazy to me. But it's and it's a small device too. It's not one of those big monster equipments that you would go see at a doctor's office. It's a suitcase. It's got 4 computers in it, one size for connective tissue, the other size for neuromuscular. So I can actually treat patients with a traumatic brain injury, with a concussion, and I can treat someone with a knee issue. And it can tell the difference between tissues in the human as well. So if it's a cartilage, if it's muscle tissue, is it a brain? So it actually can work based off, again, on frequencies. So we all have these frequencies already in our body, so this is nothing new. This device can't hurt you unless I throw it at you, which I won't do, Gina.
Be terrible. But it is a suitcase size, so it's not terrible.
Well,
you can treat it after it's done. No.
Okay. So, technically speaking, this device has the capability of giving you pain relief in such a way that you can get your range of motion back, you can get the strength back, because it works on the cellular level. And everything is made up of your cells, so you have to be able to at least get the cell to do its thing, which is to produce energy to be able to combat any type of damages that might be caused in the body. And if you don't have that energy in the cell, that cell dies. And then you have less ability to be able to heal thyself.
Okay, so how on earth, and I know everyone's thinking this, because it's cellular level, we're talking about small little pieces of the body, how does a cell become impeded or blocked, so to speak?
There are so many ways. I mean, you have an injury, the brain then shuts off certain circuits that goes to that area to protect itself. So depending on how long it's been shut off, it all depends on your body too, right? So you could have scar tissue build up there. You could have stagnant fluid that's been sitting in the tissue for a while that hasn't been squeezed out. That's toxic. So again, how much toxic load do you have in your body? So it has to be able to penetrate through in order for it to get a calculation as to what's happening in that area. And if it can't even penetrate, let's kind of use the analogy of a car battery. If I'm charging you and you can't hold that charge, that means that's an old cell. It hasn't been working for a long time.
You're gonna have old cells and old skin.
I'm sorry to report. Kidding.
Can we use Botox?
Ladies and gentlemen, she's gorgeous. Don't even think that. She's beautiful.
Goodness.
No, but it's kind of one of those things where the impedance and inflammation is determined based off how long the brain has been trained to think that area, even if that area has been healed, it's been, let's say, a year and your body is better now, but because every time you move, the brain's thinking, we need to stop this person, so they shut off muscles. So you can have fibers that are not working. You can have your glute muscle could be activated in some parts, but other parts may not be, like your medius, which attaches to your hip bone. So a lot of people have bursitis in the hips, but there are other parts of their glutes work. Well, the problem is eventually the whole area might shut down because it hasn't been corrected. So doing physical therapy is great, getting massage is great, getting chiropractic is great, but the problem with those is that it does inflame the area without
treatment.
Yeah,
right?
I mean, you're squeezing the toxins out, you're getting movement going, and you're getting the body to connect with each other. But eventually the inflammation will be your demise, because the fight or flight program that you have in your body, which is your sympathetic nervous system, will turn on. And if that gets turned on for too long, it becomes a pattern. So you're coming to me and you're expecting me to correct you in one session. That is not going to happen. But if you're acute, let's say you just did it last weekend and your shoulder hurts, well, that's perfect. I can deal with that in a couple of sessions.
Oh, I am acute. No, kidding.
You're
It's
very
an old
acute.
Old joke. But so it does work for chronic and acute symptoms.
Yeah,
then
it
at
does.
that
It
point.
just takes more time with obviously the chronic.
Makes sense. So because you're used to it, your body's telling you pain, 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 pain.
And you just deal with it.
You don't really know why, and you've
Yeah.
tried pain medications,
Right.
narcotics. The pain clinic is watching over you, thank goodness, hopefully, and you're, physician assisted when it comes to those medications. But look at the fentanyl crisis we're
Yeah.
in now. Look at people who are self-medicating because they can't get pain relief
Right.
from chronic pain.
Right.
So it's debilitating. And talk
Yeah.
about mental illness like we started out with.
Absolutely. I mean, to tell you the truth, you're talking to someone who's a very strong mind and the constitution. But when I started out with this fibromyalgia symptoms back in 2007, the quality of life was so horrible. I was like, I can't do this anymore. I mean, this is terrible. I mean, luckily, I have a spiritual side to me too, and I believe in God, and I believe that things will get better. So I work through it. But there are people who may be really alone and don't have that kind of mindset or don't have the support, and so they look at themselves and say, "This is it. This is it. This is the best it's going to get. We're done." And that's not good. That's not good at all. Pain stops you from living your quality of life, and it will stop you from thinking beyond this point.
And pain doesn't always stay physical either.
No.
There's actually a study that I did pull from your plethora of testimonials from your parent company.
Yeah.
And this is amazing. It was in, with Peso's story,
Right.
right? And that's a happy one. But, Dr. Michael Rankin Jr.
Oh, he's phenomenal, by the way.
Good.
He's one of my doctors in my pocket that I pull out once in a while and say, what do I do with this patient? Have you ever had this case?
It's good to have those.
Oh, he's phenomenal.
The physician Rolodex. So
Yes.
he's actually neuropathy.
He's a naturopath.
Naturopath.
Yeah,
Okay. And so this patient is female, 41 years old. Symptoms were medical diagnosis of severe anxiety, depression, migraines. Those certainly go hand in hand.
Yeah.
I've been a migraine sufferer since I was in high school. Feel like it's probably stress, anxiety, and all, but mental illness causes physical pain
Yep.
when it continues for so long and you don't do anything about it, like you were talking about.
Yeah.
And so this started for this patient at 41 years old, around 8 years old.
Yeah.
So she'd been living with this for over 3 decades, 3 different drugs for sleep, 2 drugs for depression, and 1 drug each for anxiety and migraine emergencies, so breakthrough and preventative medication regimens, okay? Then, of course, the acne from the steroid use, low blood sugar, just a multitude of symptoms and issues. So are you familiar with what Dr. Rankin did?
Yeah,
in order to
he
help
has
her?
he has some great protocols that he's put together, and there's we come out of this training that for the Equiscope with about 20 protocols. Chinese acupuncture points are included in it, and it's really amazing. And then there are these advanced points and advanced protocols that you come up with. And if you know your human body, which I do, and you understand where the root of the nerve is and where it ends, you kind of know there's a pathway you need to follow to find out where the actual issue might be. It may not just be your elbow, it might be your neck, right? So you need to make sure you're treating the neck as well as the elbow to get the actual results you want. And he's that kind of a doctor. So it's amazing with some of the protocols he's come up with. But I got to say to you too, is that you don't know what you don't know. And as a person who's dealing with pain or, emotional, the frontal lobe of our brain deals with stress. It's our emotional compartment.
Is that why I have those 11s?
That's why I have a lot of those wrinkles too. Something's going on. But no, it's amazing. So we put plates on the frontal lobe to help with, and some meditation exercises to help them, breathing exercises to help them through it. And it just gets their calm back, their self back. Because a lot of times you're spinning, you're thinking about things, and you're making it worse than it actually is. So we try to slow you down with ear clips, with the plates on the forehead, and get the frontal lobe to calm down a bit. And that makes a big difference in the way your body feels too. Because if you're not stressed and you're calm, you're not tightening things up, you're not squeezing things, and things will relax a lot faster.
You'll probably be able to sleep better, right?
Yeah, this helps with a lot of people who have sleep issues.
So everything's kind of secondary to finding that main electrical point. I mean, when you say that everything moves from point A to point B, it almost sounds like you're an electrician.
Yeah, it's kind of cool. I kind of feel like I'm smart that way, but I'm not.
Wow, this is interesting. So I know what's on everyone's brain. First of all, how to find you before we take our next break, and how much it costs. But we're going to save the second one for the very end of the show and make people tune in again. So
Oh, you're
how
so
do we
smart.
find you?
I'm actually working at Dr. Garza Wellness Clinic over in Lilia by Lilia Bakery, next to Kuakini, and it's really been an experience there. It's wonderful. It's easy to find too. I mean, it's got a lot of parking. I mean, everyone wants to get a cookie or a baked good from Lilia Bakery, right?
Absolutely.
Maybe you
They'll
don't.
probably get
Yeah.
stuck next door.
Well,
So.
if you want to put on extra weight here. And then
Right.
also you can find me on Instagram, which is, if you guys go there, I just put it together recently, so I don't have that many followers, but I welcome you to come on board. It's Electro Treatment 101, Electro Treatment 101,
Mhm.
or you can find me on YouTube for Be Fit for Health. So I have a lot of my radio shows on there too.
Oh, so you didn't forget about us.
No, I had memories.
Thank you. Okay, good. I don't know if this Electro Equiscope could possibly get rid of the PTSD from that, but we had a good fun. So, okay, when we come back, we are going to talk about what a typical treatment looks like, what expectation levels should be from a session standpoint, and how much is it? Don't go anywhere. We'll be right back.